Good afternoon, Nico Hidefield. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your role play.
Good morning, Mihiraa. Please come in and have a seat. I'm Derek, one of the cardiac nurses. Could you please confirm the reason for your visit today?
Hello, Derek. Thank you. I'm here to discuss my angiogram results.
Thank you for your confirmation. How are you feeling today?
Well, I'm quite anxious to be honest. I just want to know what the pictures showed and what happens next. I've been getting this tightness in my chest more often.
I understand completely. That's exactly what we're here for today. My role is to sit down with you, go through your results in detail, and talk about the management plan. This will help you feel more informed before you see the cardiologist. Mihiraa, let's first talk about what the angiogram showed so you have a clear picture. It confirmed there are two areas in the arteries that supply blood to your heart muscle, which have become narrowed. This is due to a slow buildup of a material called plaque on the inner walls of those arteries. Think of it like a pipe getting furred up over time. This narrowing reduces the flow of oxygen-rich blood to your heart, which is why you've been experiencing that chest tightness. I want to reassure you that this is a very treatable condition. The goal of any management is to restore good blood flow, prevent any further damage to your heart muscle, and most importantly, to significantly reduce your risk of having a heart attack.
So, treatable? Does that mean I need an operation? Can I get a stent put in straight away? I don't want to wait.
I hear that you want this sorted quickly, and that's our goal too. However, deciding on the specific procedure, whether it's the best approach to place stents to open the arteries from inside or whether a bypass surgery might be more suitable for your particular case, is a detailed decision. Mihiraa, it depends on many factors like the exact location and nature of the blockages. That is why it's so important for you to have a full discussion with a cardiologist. My role is to ensure you understand the condition, but the final surgical plan will be made by you and the specialist doctor together. They are the expert in determining the best option for your long-term health.
I see. So the doctor will decide. What can I do in the meantime? Is it just about an operation?
That's an excellent question, and it leads us to a very crucial part of your care, which is looking at your overall health. While some of the plaque buildup may be from past years, making positive changes now is absolutely essential. These changes help prevent new blockages from forming and improve your heart's overall efficiency and health. To help me guide you, could you tell me a bit about your current lifestyle? For instance, what your typical diet is like, how much physical activity you get, and whether you have ever smoked.
My diet. Well, I love fried foods and sweets, I must admit. I don't really exercise. I used to walk, but I stopped when my chest started bothering me. And I smoked for about 30 years, but I quit 5 years ago. Of course. Here is the nurse's single, cohesive response incorporating that specific task.
I appreciate you sharing that. It gives us a good starting point. Mihiraa, it's important to understand that while some of the plaque buildup in your arteries is historical and has happened over many years, making positive lifestyle changes now is absolutely essential. This isn't about blaming the past. The focus is on protecting your heart's future. These changes work to prevent new blockages from forming and to improve your heart muscle's overall efficiency and strength so it can do its job with less strain. It's one of the most powerful parts of your treatment plan moving forward.
I see. So it's never too late to make a change, is it? That's a bit of a relief, but it also feels like a big responsibility. I suppose I really do have to take this seriously. What else do I need to do straight away? Is it just about food and exercise, or is there medicine involved too?
You've understood that perfectly, Mihiraa. It truly is never too late, and taking it seriously is the most important step. You're right, it's not just about lifestyle. Starting medication immediately is a critical part of the plan to protect your heart right now. This typically involves two main types. First, a blood thinner like aspirin to help prevent blood clots from forming in those narrowed arteries, which is what could lead to a heart attack. Second, a medication called a statin, which works to stabilize the existing plaque, making it less likely to rupture, and it also helps lower your cholesterol to slow down any further buildup. Alongside this, a key part of your aftercare is knowing what to monitor. It's very important that you watch for any warning signs from your body. This includes any new, worsening, or more frequent chest pain or discomfort, any new shortness of breath, or feeling unusually dizzy or lightheaded. If you experience any of these, you must seek medical attention immediately. Does that make sense? And do you have any questions about starting these medications or what to watch for?
Okay, so pills to thin my blood and control the plaque, and I need to watch for those warning signs. And I need to try to eat better and move more.
That's a very good summary. Before we finish, I need to confirm the next step. Based on everything we've discussed, the results, the importance of medication and lifestyle, and the need for a specialist decision on the procedure, are you happy to proceed with the appointment to see the cardiologist to finalize your treatment plan?
Yes, I am. I feel much clearer now. Please go ahead and book that for me.
I will arrange that for you right away. Now, Mihiraa, let me just summarize our discussion so we're both clear. We talked about your angiogram results showing 2 narrowed arteries due to plaque and that this is a treatable condition. We discussed that the choice between a stent and bypass is a decision for you and the cardiologist. We cover the importance of starting medication immediately to prevent clots and stabilize plaque, and the critical need for lifestyle changes in diet and activity to protect your heart long-term. You also know the key warning signs to watch for. Your next step is seeing the cardiologist. Does that cover everything as you understand it?
Yes, Derek, it does. Thank you for explaining it all so calmly.
You're very welcome, Mihiraa. I'll get that appointment scheduled. You take care.